Well, actually, first of all, we're going to tail off and speak to Wes Streeting, the Shadow Secretary of State for Health, who joined us a little bit earlier than expected, but delighted to see. Good morning. And I see you're standing in front of some emergency care there. They're making headlines this morning, front of the Times, the rise of the 24-hour wait for a bed in A&E. How would Labour change the way A&E is coping at the moment?
Well, the reason why we've got such pressure in A&E is because of the wider system pressures in the NHS. Because people can't get a GP appointment, for example, that would cost 40 quid for the NHS, they end up in A&E departments like the one behind me here in Ashfield, which costs around £400 per head. Because of delayed discharges from hospital beds, people are waiting longer in those emergency departments than they should because beds aren't available. And why is that? Because we don't have the social care we need and the support in the community to get people discharged from hospital, which is worse for them and also more expensive than the taxpayer. And that's why today in the Sun newspaper, I've made an argument that of course we know that the NHS could do with investment, but under a Labour government, all of that extra investment would be linked to reform, because unless we change the way that the NHS does things, we'll end up being back in the position of this government where Rishi Sunak boasts that he's spending more money on the NHS than ever before at the same time as the NHS is going through the worst crisis in its history. And personally, I don't think that spending vast amounts of taxpayers' money and getting really bad outcomes for patients and a bad service for our country is anything to boast about. And that's why Labour, the party that created the NHS, and the party that has a much better record on the NHS, is the party that's well placed to take the NHS from its worst crisis in history to get it back on its feet and make sure it's fit for the future.
But Wes, what about the way we do things as well, and can we help ourselves? Now, you're talking about something today which I find very interesting because, I'm not at an age where my kids are growing up and whatever. I don't know if I'm at risk from this myself, but measles. Measles is something that you want to talk about today. Why is that?
Well, believe it or not, I mean, this is another just extraordinary thing about where we are now in our country. We were a measles-free country, but for the last 7 years, the number of people taking up the MMR vaccine has been going down. And so measles is now a feature of our country once again. And I think we could almost be too complacent about this. Because we got rid of measles for a long time, we forget that measles can be a killer. And that's why we want to make it as easy as possible for people to do the right thing. New parents will be aware, in fact, some not so new parents who probably, if they had a rummage around the kitchen drawer or, in a cupboard somewhere, would find their children's Red Book. This is the Red Book that's given to all newborns, and it's meant to be children's health records, and it's meant to record things like their immunisations and vaccines and all of those important parts of early years children's healthcare. But these are still paper-based in the 21st century, and I think this is crazy. What we're proposing to do is digitise the Red Book, saving £2 million a year that's currently spent on printing these Red Books, but even more importantly, making it easy for parents to access those children's records, and also making it really easy for the NHS to send parents reminders to say, you haven't had your second MMR jab, or you're overdue a health check, whatever it might be, to make sure that we get the basics right first time. Because if we don't get the basics right first time, we end up paying a much heavier price down the line. And I'm afraid this is the story of the NHS today. One of the reasons it's under massive pressure is because people haven't taken enough control of their own healthcare, and we end up putting a greater pressure on the NHS. So we've all got to do our bit to keep ourselves fit and active and healthy.
Yeah, look, most people, I think, would agree that it's a great idea if it gets more kids immunised against things like measles, as you say, a big killer, and really important to take it seriously. But I mean, as someone whose kids have Red Books, I don't have a problem with using those, and obviously we don't want to be backward with technology. If we can digitise things, great, but is that going to come at a cost, and have you costed it? Because at the moment, we've moved house recently, our GP just sends a sort of blanket text to everybody saying, make sure your immunisations are up to date, please come and see us with your Red Book. That's working, that's reminding parents to come, get in touch. I mean, this would be a very expensive way of trying to get people through the door and get them those MMR vaccines, isn't it?
Well, I mean, there are some upfront costs of developing the NHS app, but it will save money over time. We're spending £2 million printing red books, and this is, I mean, I've given you one example in the red book, but take a look at the front page of the Telegraph the other day, where NHS leaders and government were complaining that Royal Mail failures are meaning that people are getting their letters too late, sometimes missing appointments because the letter telling them about the appointment didn't arrive in time. Now, I've got some sympathy with complaints about the service provided by Royal Mail, but actually, shouldn't the emphasis of the NHS be on reducing the amount of postage? Why aren't we digital by default? Of course, there will always be some people who don't, for whatever reason, have access to smartphones or Wi-Fi, or are just not comfortable with using technology in that way. Then by all means send those people a letter. But, you know, ask any GP, ask any patient, ask any consultant. The NHS runs on paper, and for years and years the Tories have promised action on this and failed to deliver. We have a technological transformation fund in the NHS. Let's put it to good use to reduce our reliance on paper, to reduce our reliance on stamps and Royal Mail, and to provide people with a modern service in a way that they access pretty much every other major service in their life at the moment, whether that's online shopping and retail or anything else we do by apps.
And Wes, just talking about your piece you've written in The Sun about how this is a service and not a shrine, and wanting to reform the NHS. You went on a delegation, didn't you, to Australia with a team just before Christmas, looking at what you can learn from their setup there. And my understanding is that you concluded where you have a private sector that is high functioning alongside a public sector, you actually get better health outcomes.
Well, it seems mad to me that we've got spare capacity in the private sector where we're not using it. And you've got a situation today where middle and upper class people who can pay to go private are being seen faster, getting diagnosed more quickly and treated more quickly, which is certainly better for their quality of life, but better for their outcomes. And then working class people are left behind because they're priced out of this two-tier system. Now, what I'm proposing is that a Labour government would use spare capacity in the private sector to bring down waiting lists faster, but no one will have to worry about the bill, and that service would be provided to working class people who otherwise wouldn't be able to access that capacity, but as they would if they walked into an NHS hospital, they will not get hit by a bill. Now, in some ways I'm not happy about this, because I think the NHS should have the staff, the equipment, the technology it needs without relying on the private sector, but I've got to deal with the world as it is after 14 years of Conservative government, not the world as I would wish it to be. And that's why I'm making that punchy argument in The Sun today. I've already had howls of outrage online from lots of middle-class lefties complaining about it, but they're not the ones who are waiting for months and months and months in pain and agony, and they are also the sort of people who quietly and privately would say, well, of course I had to pay for a scan, or my uncle or sister or brother had to pay for a scan. A lot of people in our country are not in a position to do that, and I would struggle to look someone in the eye and say, I'm sorry, I'm not going to pay via the NHS for you to be seen faster because my principles are more important than your healthcare. So I'm making both a pragmatic argument that the capacity is there, but also a principled argument, which is I'm not prepared to see working class people priced out in this terrible two-tier system the Tories have created. And of course, in the longer term, it's Labour's ambition through workforce expansion, doubling the number of scanners, and building on our proud record as a party of making sure that in future the NHS has the staff, the equipment and the technology it needs to treat patients on time, and to honour that founding principle of the NHS as a public service, free at the point of use, there for us when we need it.